One thing that we hope for with machine learning is that we can draw on the knowledge of thousands of doctors and deploy that system everywhere, so that we don't have to rely on the skill of the single doctor. We can pool the knowledge of many of them. My research is about using machine learning to make better data-driven decisions, and I work a lot with applications in healthcare. A typical example would be to learn to identify conditions that a patient might have based on, say, X-ray images of their body. So we collect a number of images of historical patients and we collect their diagnoses, and from that a computer, can learn to associate features of the image and what diagnosis was made. Different doctors might do different things with the same patient just based on differences in training or differences in personal preference and things like that. And it's often the case that certain practices that are developed take time to spread through the healthcare system. So that means the disadvantaged areas, for example, in the world where they don't have the strongest doctors, they don't have the strongest equipment and so on, they will treat their patient worse than what we could potentially do. Another reason we might like to use AI in healthcare is that the doctors and the nurses, they're very stressed all the time. They don't have enough resources to do their job well at all the time. And even if they can do it well, they would like to get some relief from the immense time pressure. So in the case of radiology, the hope is that we can speed up the process of analyzing X-ray or CT or MRI images, so that the doctor can do other things that the machine can't do yet. So both speeding up the process and also increasing the quality across the globe. Those are goals certainly for AI. So one of the big challenges with machine learning is that we almost never have the right data and enough data. So that means that it might be that when a physician looks at an X-ray, they also know something about the patient from before, they know something about their medical history, they also know something about biology and how the body works. But the machine only gets the image. And so the machine is at a big disadvantage. And one of my research projects is about building in more domain knowledge into the process of learning from such images. The other thing is that we only have as many sample images or as many examples as we can collect. And so if we're working with rare diseases, for example, then it's very often that we won't have sufficiently many examples for the machine to learn to generalize from the examples that we get. There are a number of ways to try and combat this. So one thing is that we build more sample-efficient methods, meaning we build methods that generalize better after seeing fewer examples. The other aspect that I look at in my work is how can we give the computer more information, more context, so that it can become more sample efficient. So instead of saying, okay, we only have these 100 X-rays and the diagnoses that were made for these X-rays, we also can add context variables. We can introduce, for example, the medical history. We can try and build on domain knowledge that doctors have about biology. And in doing so, we also improve the efficiency of these methods.